Hello friends, myself Dr. Shambho Shamrat Shamazdar. I had done my MD in pharmacology and DM in clinical pharmacology, along with my diploma in allergy, asthma, immunology, with postgraduate diploma in endocrinology and diabetes from Royal College of Physicians, along with my fellowship in respiratory and critical care under the aegis of West Bengal University of Health Science. Currently, I am attached with Allergy Asthma Treatment Center, Kolkata, which is a renowned center for providing treatment in the field of allergy. Today, we are going to discuss about some important aspects in managing allergy. And I think many of us who are viewing today, when we talk about allergy, they know there are certain medicines which is easily available in the medicine counter. They will go and they will take that and they will get some relief from their symptoms. But actually, whether it is right or wrong, we will discuss. So first of all, it is important to acknowledge more than 30% of our population is suffering from allergy and related illness. This allergy could be allergic rhinitis associated with running nose, sneezing, then itchiness inside the nasal mucosa or itchiness inside throat. That could be associated with allergic conjunctivitis. Often we say allergic rhinoconjunctivitis associated with itchy eyes, some watering. Along with the patient may suffer from asthma, the allergic asthma, which can be manifested as cough, chest tightness, shortness of breath, and a wheezy sound from their chest. Apart from that, there is an entity called as atopic dermatitis. When there is some lesions in the skin, and that particular lesion mostly in the flexure region of our body. So there is a itchy rashes, and sometimes there could be a possibility of exfoliative lesions. So atopic dermatitis or eczema, eczematous lesion. Along with that, often we have urticaria, that is a itchy skin with some wheal response. The skin becomes swollen, and that is also known as urticaria. But many times urticaria is not due to typically allergy, that could be autoimmune in nature. And we had discussed last time about autoimmunity and allergy. So many times we faced autoimmune urticaria. So for this all disease, we use anti-allergy medication. Often we term this as anti-allergy, but there are lots of medications we have for managing allergy. But here we will use some antihistamines, maybe levocetirizine, cetirizine, fexofenadine group of drugs, and we get relief from those symptoms. But whether it is right? So when we talk about a typical allergy, a concept is now growing up, that is allergen immunotherapy. Because it is not always right to suppress your symptoms using some medications like these antihistamines. But we need something which may switches off allergy. So many scientists had proven that allergen immunotherapy, they can switches off allergy. Although whatever medications we have, they are very effective usually. But most importantly, they do not cure people. But allergen immunotherapy is something which is the closest thing that we have a something cure for allergy. But again, I must appreciate, I had mentioned, it is the closest thing. It is not the absolute thing. Because there is this terminology cure is not good for us, because cure is something that means the disease which I have is totally vanished from my body. So that is generally we see in case of certain infections, like it could be malaria, it could be dengue, it could be some other viral infections or bacterial infections, or even in some case of cancers, the cure terminology can be used most appropriately. But in the field of allergy, this cure terminology we often use, but may cause misinterpretation. So allergen immunotherapy is not an absolute cure from allergy, but it is the closest thing. Why? Because whatever pathology is inside in our body, that can be altered, modified via this allergen immunotherapy. So studies had shown this allergen immunotherapy reduce severity of symptoms and most importantly, need of medications for many allergy sufferers. So the medication score will be reduced along with the symptoms burden will be reduced. So when we talk about allergen immunotherapy, it generally involves the regular administration of gradually increasing doses of allergen extracts over a period of years. So in general, we advocate allergen immunotherapy for 3 to 5 years. As of now, we have subcutaneous allergen immunotherapy. And when we talk about subcutaneous, there is another option, that is sublingual immunotherapy. But as of now, it is not approved. This sublingual immunotherapy is not approved in India. So allergen immunotherapy, they modify our system, our immune system, especially they changes the way our immune system reacts to allergen by switching off the allergy. So we become tolerogenic to the allergens. So this is an important tool we have, but most importantly, we need to understand that this is not a quick fix from a treatment point of view. Those who are agreeing to allergen immunotherapy need to be committed for 3 to 5 years at least to have a proper working by this important tool. So we need to cooperate with our doctor to minimize the frequency of side effects too. So allergen immunotherapy is beneficial in certain allergic conditions. So in case of stinging insects associated life-threatening allergic reactions, this allergen immunotherapy, known as venom immunotherapy, can reduce the risk of severe reactions. But unfortunately, in our country, it is not that available. But we use this tool in case of allergic rhinitis, or many of us say it as hay fever due to pollen or dust mite, or sometimes in some asthma cases. It has definite role when the asthma is allergic in origin. So in allergic asthma, we often use this tool too. When the symptoms are severe, the cause is difficult to avoid, like rust pollen or dust mites, medications don't help or cause adverse side effects. Adverse effects, like I can share a story of one of my patient who cannot tolerate the inhalational corticosteroids, but she was suffering from asthma. What we can do? With a single dose of inhalational corticosteroid, that particular patient had a symptoms of diminished visions, and if she continue that, she will have a blindness, temporary blindness. Her ophthalmologist told there was macular edema due to steroid, inhalational corticosteroid. So when they're withdrawing the inhalational corticosteroid, that macular edema become reversible. The patient again regain back her vision. So she cannot take inhalational corticosteroid. So we had used some oral medications. Along with, we had initiated allergen immunotherapy after 3 to 5 years, with only maybe sometimes he requires that oral medications. With SOS basis, the patient had a requirement of salbutamol inhalers, but that is very less now. So she had a very good symptoms control. So this is very important when there is a patient cannot tolerate any medications due to the side effects. If we use this modality, allergen immunotherapy, that can help our patient to reduce the medication burden. So allergen immunotherapy is only occasionally recommended for the treatment of atopic eczema also. There are certain studies which had shown its efficacy on that. Again, we must appreciate the improvement with allergen immunotherapy does not occur immediately. It usually requires at least 4 to 5 months before symptoms improve, and sometimes longer. So if you are having this treatment, so you will usually see improvement quite clearly in the first session. So it is recommended allergen immunotherapy need to be continued for at least 3 to 5 years to reduce the likelihood that your allergies will return. And whilst undergoing this allergen immunotherapy, you can still use your allergy medications as prescribed by your doctors. Especially this is important in the beginning period when we are building up the allergen immunotherapy. This is very important. Many of our patients, they think, now I am taking the vaccine, this allergen immunotherapy, so I will stop all the medications. This is not right. Allergen immunotherapy, along with medications, that should be continued. That medication should not be stopped. According to your need, according to your clinical picture, the physician will decide how to de-escalate the dose of the medication, how to de-prescribe the medication. So that is mostly important. You should not stop the medications. Talk with your physician, they will decide. So along with allergen immunotherapy, you need to continue the medications. But absolutely, it is important to note, allergen immunotherapy will help you to reduce the medication need. So this is a very important tool. We also need to know about some side effects. Every drug which has some effect, that must have some side effect. We need to understand that. Commonly, it is not some severe type of reactions. Very rarely, it is mostly uncommon to have some severe reactions like anaphylaxis. But we need to predict who might have these serious reactions. And this prediction is difficult because anaphylaxis is mostly unpredictable. And we need to ask our patient to remain in their doctor's chamber or clinic, the allergy clinic, for at least 30 minutes after the injection. Avoid exercising at least 3 hours. This 3 hours is important. Do not do any exercise after taking this immunotherapy. If you are taking some medications, concomitant medications, please discuss that with the prescribing doctors. And taking a non-sedating oral antihistamines before the injection may reduce the risk of side effects, and sometimes that is recommended by treating physicians, treating allergologists. So it is important to inform your doctor about any reactions you may have experienced in the last injection. And of course, if there is a possibility of some localized swelling at the site of the injection, but that can be treated with non-sedating oral antihistamines, or sometimes we may use some ice packs if it is painful, or even paracetamol. Talk with your doctor about that swelling, because according to the swelling size, if it is significant, your doctor may need to reduce the next dose, and according to that, they can plan for further escalation of allergen immunotherapy. So patients who are pregnant or planning to become pregnant in the near future are not routinely commenced on allergen immunotherapy until after they have given the birth. If the patient is on maintenance dose, so after the building up phase covered, then patient is in maintenance dose of allergen immunotherapy, then become pregnant, we can continue the injections unless the patient wishes to stop. but the supervising specialist should be contacted to discuss relevant safety issues. So if I am not yet started, the patient not taken the injection and become pregnant or planning for pregnancy, it is better not to start there. But already the patient taken the building up period of immunotherapy, then the patient is on maintenance phase of allergen immunotherapy. So there is no need to stop the allergen immunotherapy. They can continue allergen immunotherapy. But of course, they need to talk with the supervising specialist. And if patient wishes to stop, we can stop. So I think this is a very important tool we have with us, that is allergen immunotherapy. If we follow 5 rights, that is the right patient, right candidate for allergen immunotherapy, right drug, that means right composition of allergen immunotherapy, right time. If the patient is already progressed to some irreversible airway disease, so it will not give that much benefit. And allergen immunotherapy gives maximum benefit when we initiate it early phase of disease. So right time is important, and right dose of that particular vaccine, and of course the right route. Here we use subcutaneous allergen immunotherapy. So these 5 rights, if we follow, then allergen immunotherapy is definitely a very good solution for allergic diseases, as like we often treat allergic rhinitis, allergic rhinoconjunctivitis, and allergic asthma, and in some subset of atopic dermatitis or eczema patients. So again, I must end here with saying allergen immunotherapy, the evidences are good with this option. So you can feel free to talk about this option with your doctor. And in the field of allergy, this is the only tool which can modify the disease process, the natural history of disease, natural course of disease that can be altered if we use allergen immunotherapy rationally. Thank you all. For any question, you can put that in the comment section. We will try to communicate with you. But most importantly, stay happy and stay healthy. Thank you. Thank you very much.